Question 1. In the context of radiopharmaceutical production, the choice of method for producing radionuclides is critical to the quality and availability of the radiopharmaceutical. When comparing reactor-based and cyclotron-based methods, which of the following statements about their differences is true? A. Reactor-based methods are generally used for short-lived isotopes, while cyclotron-based methods are used for long-lived isotopes. B. Cyclotron-based methods typically require more stringent safety protocols due to higher radiation exposure compared to reactor-based methods. C. Reactor-based methods tend to produce higher specific activities than cyclotron-based methods, making them more suitable for PET imaging. D. Cyclotron methods are better for producing isotopes that have high neutron capture cross-sections, which is essential for certain radiopharmaceutical applications. Answer. Correct answer. B. Cyclotron-based methods typically require more stringent safety protocols due to higher radiation exposure compared to reactor-based methods. Explanation. Cyclotron-based methods involve bombarding target materials with high-energy particles like protons, often resulting in higher radiation exposure and a need for stricter safety protocols compared to reactor-based methods. When neutrons are used, reactor methods are suited for producing isotopes with higher specific activities, but cyclotrons offer the advantage of on-demand production, particularly for short-lived isotopes, critical for PET imaging. Question 2. Given the circumstances of radiopharmaceutical labeling, a radiochemist is attempting to label a molecule with technetium-99 meters, Tc99 meters, for SPECT imaging. Which of the following factors is most critical to ensure the successful attachment of Tc99 meters to the molecule? A. The molecule should have a high affinity for the target tissue but should not bind too strongly to ensure rapid excretion. B. The chelating agent must have a high dissociation constant to ensure the stability of the Tc99 meters complex during the imaging procedure. C. The pH and temperature conditions during the labeling process must be optimized to prevent the breakdown of the Tc99 meters complex. D. The use of strong oxidizing agent during the labeling process is essential to ensure the Tc99 meters binds efficiently to the molecule. Answer. Correct answer A. Thin layer chromatography, TLC. Explanation. Thin layer chromatography, TLC, is widely used in radiopharmaceuticals for assessing radiochemical purity. It is a simple and effective method for identifying impurities in unreacted starting materials by comparing the movement of the radiolabeled compound with standards under specific conditions, where HPLC and mass spectrometry are useful for detailed analysis. It particularly favored due to its speed, ease of use, and cost-effectiveness in quality control settings. Question 3. Correct answer. C. The pH and temperature conditions during the labeling process must be optimized to prevent the breakdown of the Tc99 meters complex. Explanation. The stability of Tc99 meters complexes is highly dependent on the chemical environment, particularly the pH and temperature. An optimal environment prevents the Tc99 meters from dissociating from the chelating agent, ensuring the int of the radiopharmaceutical for effective imaging. Proper chelation is crucial for stability, but other factors such as dissociation constants and oxidizing agents are less critical compared to temperature and pH control. Answer. In light of recent developments in radiopharmaceutical quality control, which of the following techniques is most commonly used to test for radiochemical purity in a radiopharmaceutical? A. Thin layer chromatography, TLC. B. High-performance liquid chromatography, HPLC. C. Mass spectrometry, MSD. Gamma spectrometry. Question 4. Under the assumption that a radiopharmaceutical undergoes degradation over time, what would be the most appropriate course of action to maintain the quality of the product for patient use? A. Store the radiopharmaceutical at ambient temperature to prevent further degradation. B. Regularly assess the radiopharmaceutical's radiochemical purity using advanced techniques like HPLC. C. Discard any radiopharmaceuticals that show signs of degradation, even if they are within acceptable limits. D. Perform relabeling procedure using fresh isotopes to restore the radiopharmaceutical's potency. Answer. Correct answer. B. Regularly assess the radiopharmaceutical's radiochemical purity using advanced techniques like HPLC. Explanation. Regular quality control checks, including radiochemical purity assessments using advanced techniques like HPLC, are essential to ensure that radiopharmaceutical retains its effectiveness and safety for use. Discarding or relabeling is not recommended unless there is significant loss of quality. Acceptable limits. Proper storage conditions are critical but do not fully prevent degradation, making consistent monitoring essential. Question 5. Taking into account the biological effects of ionizing radiation, a medical physicist is evaluating the organ dose for a patient undergoing a diagnostic SPECT scan using TC99 meters. Which of the following factors would most likely influence the dose received by the patient's organs? A. The patient's body mass and age, as they can affect the distribution of the radiopharmaceutical. B. The physical half-life of TC99 meters, as it determines the duration of exposure. C. The specific activity of the TC99 meters used in the scan, as it influences the radiopharmaceutical's concentration. D. The resolution of the SPECT scanner, as higher-resolution images require higher doses of radiation. Answer. Correct answer A. The patient's body mass and age, as they can affect the distribution of the radiopharmaceutical. Explanation. The distribution of the radiopharmaceutical within the body is influenced by various factors, including the patient's body mass, age, and organ function. These factors can alter the biodistribution and therefore the radiation dose received by specific organs. While the physical half-life and specific activity of TC90 meters are important, they are secondary to the biological and physiological factors in determining the final organ dose. Question 6. From the perspective of radiopharmaceutical preparation, which of the following methods is most commonly used for the reconstitution of a radiopharmaceutical kit in the clinical setting? A. The kit is reconstituted by adding a saline solution and allowing the radioactive component to spontaneously bind to the molecule. B. A sterile and non-pyrogenic diluent is added to the kit under aseptic conditions to avoid contamination. C. The kit is reconstituted using a concentrated solution of radioactive material, which is then diluted. D. The reconstitution process requires the addition of a stabilizing agent to prevent the radioactive component from being oxidized. Answer. Correct answer. B. A sterile and non-pyrogenic diluent is added to the kit under aseptic conditions to avoid contamination. Explanation. The preparation of radiopharmaceutical kits requires strict aseptic conditions to prevent contamination and ensure the sterility and pyrogenicity of the final product. A non-pyrogenic diluent is essential to avoid adverse reactions in patients. The addition of stabilizing agents may be used for specific kits, but the primary concern is the maintenance of sterility and non-pyrogenicity. Question 7. Several experts suggest that in order to enhance the therapeutic efficacy of targeted radionuclide therapy, which of the following factors must be considered when designing a new radiopharmaceutical? A. The ability of the radiopharmaceutical to localize specifically at the tumor site without affecting nearby healthy tissues. B. The high energy emissions of the radionuclide, as these would lead to better penetration of radiation into deep tissues. C. The use of isotopes with a very short half-life to minimize patient exposure to radiation. D. The availability of a large quantity of radionuclide from cyclotron-based production method. Reduce. Answer. Correct answer A. The ability of the radiopharmaceutical to localize specifically at the tumor site without affecting nearby healthy tissues. Explanation. The key to effective targeted radionuclide therapy lies in the ability of the radiopharmaceutical to selectively bind to the tumor cells while minimizing radiation exposure to surrounding healthy tissues. This requires a well-designed radiopharmaceutical with high specificity for the target site. While half-life and high-energy emissions may be important in some contexts, they are secondary to specificity in therapeutic applications. Question 8. Through careful analysis of radiopharmaceuticals used in oncology, which of the following is the most commonly used tracer for PET imaging in the diagnosis of tumors? A. Sodium fluoride NaF. B. Fluorodeoxyglucose FDG. C. Iodine 123 I123. D. Gallium 67 Gu67. Answer. Correct answer B. Fluorodeoxyglucose FDG. Explanation. Fluorodeoxyglucose FDG is the most widely used radiopharmaceutical for PET imaging, particularly in oncology, due to its ability to mimic glucose and accumulate in areas with high metabolic activity, such as tumors, while NAF-123 and Go67 are used for specific imaging applications. FDG is the most effective tumor detection, especially for assessing tumor activity and metabolism. Question 9. In response to concerns about radiation exposure in diagnostic imaging, a radiologist is considering the most effective methods for reducing patient radiation doses in SPECT and PET scans. Which of the following approaches would likely result in the most significant reduction in patient exposure? A. Decreasing the amount of radiopharmaceutical administered while maintaining the imaging quality. B. Increasing the imaging resolution to ensure a higher quality diagnostic image. C. Using a lower energy radionuclide for the scan. D. Reducing the scanning duration to decrease total radiation exposure. Answer. Correct answer A. Decreasing the amount of radiopharmaceutical administered while maintaining the imaging quality. Explanation. Reducing the dose of radiopharmaceutical administered is one of the most effective methods for minimizing patient radiation exposure while still obtaining quality imaging results. Increasing resolution or using a low-energy radionuclide may improve image quality but would not necessarily reduce the radiation dose, effectively as reducing the radiopharmaceutical dose. Question 10. When evaluating the biodistribution of a radiopharmaceutical, which of the following techniques would provide the most detailed information on the localization of the tracer in tissues and organs? A. Gamma spectrometry. B. Thin-layer chromatography. C. Autoradiography. D. Liquid scintillation counting. Answer. Correct answer. C. Autoradiography. Explanation. Autoradiography provides high spatial resolution and detailed images of the distribution of radiolabeled compounds within tissues. It allows precise localization of the radiopharmaceutical at the microscopic level, which is invaluable in understanding biodistribution and ensuring proper targeting. Other techniques like gamma spectrometry and liquid scintillation counting offer broader, less detailed data. Question 11. Given the circumstances of a radiopharmacy environment, what is the most critical factor to ensure that the radiopharmaceuticals prepared meet the required standards of safety and quality for patient administration? A. Ensuring that all staff undergo regular training sessions on radiopharmaceutical handling. B. Validation of radiopharmaceutical preparation and adherence to good manufacturing practice (GMP). C. Limiting the shelf life of radiopharmaceuticals to no more than 12 hours. D. Using automated systems exclusively for radiopharmaceutical compounding. Answer. Correct answer. B. Validation of radiopharmaceutical preparation and adherence to good manufacturing practice (GMP). Explanation. Validation of radiopharmaceutical preparation is a critical process to ensure that the radiopharmaceutical meets the required standards for patient safety and efficacy. GMP guidelines, as per regulatory authorities such as the FDA and EMA, require strict controls to be in place for aspects of radiopharmaceutical production, including labeling, packaging, storage, and distribution. It ensures that the process consistently produces products of the required quality. While staff training and limiting shelf life are important, they are not the most critical factor in ensuring compliance with safety and quality standards. Question 12. What could be a primary consequence of failing to properly validate radiopharmaceutical formulations in a clinical setting? A. Increased radioactivity levels in the patient's body beyond safe limits. B. Reduced biodistribution and localization of the radiopharmaceutical. C. A failure to meet regulatory requirements leading to potential legal consequences. D. Inaccurate radiation dosimetry calculations. Answer. Correct answer. C. A failure to meet regulatory requirements leading to potential legal consequences. Explanation. Proper validation ensures that the radiopharmaceutical meets specific quality criteria including sterility, pyrogenicity, and stability. If this validation is neglected, it can lead to non-compliance with regulatory standards, potentially resulting in legal action, fines, or the suspension of clinical trials. While increased radioactivity or dosimetry errors could occur, the most significant consequence is often regulatory action. Furthermore, incorrect formulation validation could have adverse patient health implications if undetected. Question 13. To what extent does the use of cyclotron-produced radionuclides in positron emission tomography (PET) impact their application in clinical diagnostics compared to reactor-produced radionuclides? A. Cyclotron-produced radionuclides generally have longer half-lives than reactor-produced ones, providing more time for imaging. B. Cyclotron-produced radionuclides often have higher costs and limited availability, which restricts their use in widespread clinical diagnostics. C. Cyclotron-produced radionuclides are not suitable for PET imaging due to their shorter half-lives. D. Cyclotron-produced radionuclides have radiation exposure risks compared to reactor-produced radionuclides. Answer. Correct answer. B. Cyclotron-produced radionuclides often have higher costs and limited availability, which restricts their use in widespread clinical diagnostics. Explanation. Cyclotron-produced radionuclides, such as fluorine-18 used in FDG for PET, typically have short half-lives, requiring the cyclotron to be in close proximity to the clinical site. This limited availability can increase costs and affect the widespread use of certain PET radiopharmaceuticals. In contrast, reactor-produced radionuclides like technetium-99 are more readily available and have longer half-lives, which are more suitable for widespread clinical use. Question 14. When considering radiation safety, what is the primary consideration in managing radiation exposure to radiopharmaceutical production personnel? A. Ensuring all personnel wear protective gloves at all times. B. Maintaining a safe distance from the radiation source during production and administration. C. Monitoring the ventilation system to prevent radiation buildup in the workspace. D. Reducing the time spent handling radiopharmaceuticals by increasing automation. Answer. Correct answer. B. Maintaining a safe distance from the radiation source during production and administration. Explanation. One of the key principles of radiation safety is minimizing exposure by controlling the time, distance, and shielding. By maintaining a safe distance from radiation sources, production personnel reduce their exposure, which is particularly important given the short-lived nature of many radionuclides. While the methods like protective gloves and automation are helpful, distance remains the most significant factor in minimizing exposure to ionizing radiation. Question 15. Considering the principles of radiopharmaceutical chemistry, how does the choice of ligand in radiolabeling affect the stability and specificity of a radiopharmaceutical? A. The choice of ligand does not significantly impact the stability but affects the biodistribution of the radiopharmaceutical. B. A strong ligand-receptor interaction generally enhances the specificity but may reduce the radiochemical stability. C. Ligands with a high affinity for the radionuclide ensure both higher stability and specificity in the final radiopharmaceutical product. D. The choice of ligand has minimal effect on both stability and specificity, as radiopharmaceuticals primarily rely on radionuclide decay rates. Answer. Correct answer. C. Ligands with a high affinity for the radionuclide ensure both higher stability and specificity in the final radiopharmaceutical product. Explanation. In radiopharmaceutical chemistry, the ligand is a critical component that determines both the stability of the radiopharmaceutical and its ability to target specific receptors or tissues. A high-affinity ligand binds strongly to the radionuclide, enhancing both its chemical stability, reducing the risk of radiolabeling, and its specificity for the desired tissue or receptor, which is essential for effective imaging or therapy. The choice of ligand is fundamental in designing effective radiopharmaceuticals. Question 16. What is a critical step to ensure the correct radiolabeling of a biomolecule with a radionuclide considering both stability and biological activity? A. Ensuring that the radiolabeling reaction is carried out at high temperatures to speed up the process. B. Using a chelator to bind the radionuclide to the biomolecule, ensuring both stability and minimizing potential interference with biological activity. C. Minimizing the use of solvents in the radiolabeling process to avoid affecting the biological activity. D. Employing excess radiolabeled precursor molecules to ensure radiolabeling of the biomolecule. Answer. Correct answer. B. Using a chelator to bind the radionuclide to the biomolecule, ensuring both stability and minimizing potential interference with biological activity. Explanation: the use of a chelator, a molecule that binds tightly to a metal ion or radionuclide, is essential in radiolabeling. It ensures that the radionuclide is securely bound to the biomolecule, preventing it from dissociating and potentially toxicity. This also maintains the biomolecule's biological activity, allowing it to target the intended tissue without interference from the radionuclide. High temperatures or excess precursor molecules may not provide the necessary stability and could alter the biomolecule's biological activity. Question 17. Which of the following methods is commonly employed to assess the purity of radiopharmaceuticals prior to their clinical use? A. Mass spectrometry for determining chemical composition. B. Thin layer chromatography (TLC) for evaluating radiochemical purity. C. Gamma spectrometry to assess the physical properties of the radionuclide. D. High performance liquid chromatography (HPLC) for evaluating the structural integrity of the compound. Answer. Correct answer B. Thin layer chromatography (TLC) for evaluating radiochemical purity. Explanation: thin layer chromatography (TLC) is a standard technique used to evaluate the radiochemical purity of radiopharmaceuticals. It is particularly useful for separating and identifying different components of a radiolabeled compound based on their affinity for the stationary phase. This ensures that the radiopharmaceutical is chemical and that unwanted free radionuclides or degradation products are not present. Other methods like mass spectrometry or HPLC are also used, but ELC is specifically tailored to assessing radiochemical purity. Question 18. From the perspective of radiation safety, what is the most effective way to reduce radiation exposure to patients undergoing diagnostic imaging with radiopharmaceuticals? A. Use the lowest possible dose of radiopharmaceuticals that provides adequate imaging quality. B. Use shielding materials during imaging to minimize radiation exposure to surrounding tissues. C. Administer radiopharmaceuticals only during specific time windows to reduce exposure. D. Perform imaging procedures in shorter intervals to minimize radiation dose accumulation. Answer. Correct answer A. Use the lowest possible dose of radiopharmaceuticals that provides adequate imaging quality. Explanation: YALARA, as low as reasonably achievable, principle is central to radiation safety. In diagnostic imaging, it is important to use the lowest possible dose of radiopharmaceuticals that still allows for effective imaging. This minimizes radiation exposure to the patient while ensuring that high-quality images can still be obtained for diagnostic purposes. Shielding and timing strategies also contribute to safety but are secondary to minimizing the dose. Question 19. What factors should be considered when selecting an appropriate radiopharmaceutical for imaging a tumor in a patient with metastatic cancer? A. The radiopharmaceutical's ability to specifically bind to tumor receptors and its biodistribution profile. B. The radiation energy level of the radionuclide, as high energy is more effective in imaging smaller tumors. C. The radiopharmaceutical's half-life should be long enough to provide sufficient time for imaging, but not necessarily optimized for tumor targeting. D. Only the biological activity of the biomolecule is relevant, for the radionuclide selection is secondary. Answer. Correct answer A. The radiopharmaceutical's ability to specifically bind to tumor receptors and its biodistribution profile. Explanation: when selecting a radiopharmaceutical for tumor imaging, specificity for the tumor is critical. Radiopharmaceuticals must target specific receptors on tumor cells, which is essential for effective imaging of both primary and metastatic tumors. Additionally, their biodistribution profile, ensuring that accumulate in the tumor and not in other tissues, is a key consideration. Radiation energy levels and half-life are secondary factors to ensure quality imaging without unnecessary radiation exposure. Question 20. When analyzing the biological effects of ionizing radiation, what primary distinction should be made between stochastic and deterministic effects? A. Stochastic effects occur at high doses and deterministic effects occur at low doses. B. Stochastic effects are random in nature and their probability increases with increasing dose, while deterministic effects have a threshold dose below which they do not occur. C. Stochastic effects are reversible, while deterministic effects are always irreversible. D. Stochastic effects are mainly observed in imaging, while deterministic effects are limited. Therapeutic radiation exposures. Answer. Correct answer. B. Stochastic effects are random in nature and their probability increases with increasing dose, while deterministic effects have a threshold dose below which they do not occur. Explanation. Stochastic effects are those that occur randomly, with the probability of occurrence increasing as the radiation dose increases. These effects include cancer and genetic mutations, and they do not have a threshold dose. On the other hand, deterministic, such as skin erythema or cataracts, require a certain threshold dose to manifest. Once this threshold is exceeded, the severity of the effect increases with dose. Understanding this distinction is crucial in radiation safety and protection protocols. Question 21. Which of the following is a common method used to assess the radiochemical purity of a radiopharmaceutical? A. Gamma spectrometry for measuring the radionuclide energy levels. B. Thin layer chromatography (TLC) for separating and identifying the radiolabeled compound. C. Mass spectrometry for evaluating the radiopharmaceutical's chemical structure. D. Ultraviolet (UV) spectrophotometry for detecting radiation absorption in the compound. Answer. Correct answer. B. Thin layer chromatography (TLC) for separating and identifying the radiolabeled compound. Explanation. Thin layer chromatography (TLC) is a widely used technique in radiopharmaceutical science to assess the radiochemical purity of the product. It helps separate the radiolabeled compound from any free radionuclides or impurities. This is crucial for ensuring the compound's safety and efficacy before clinical use. Gamma spectrometry and UV spectrophotometry are used for other analyses, but TLC is the primary method for assessing purity. Question 22. What is the main concern when using iodine 131 for therapy and thyroid cancer treatment? A. The high energy emission can lead to tissue necrosis at treatment sites. B. The half-life of iodine 131 is too short for effective treatment. C. The radiation emitted can affect surrounding normal tissues and organs. D. The isotope has low specificity for thyroid tissue, leading to poor treatment outcomes. Answer. Correct answer. C. The radiation emitted can affect surrounding normal tissues and organs. Explanation. Iodine 131 is used in the treatment of thyroid cancer because it is specifically taken up by thyroid tissue. However, the radiation emitted can also affect surrounding tissues and organs, leading to potential side effects. The risk is particularly significant in cases where thyroid tissue is located near critical structures like the salivary glands. Its half-life is suitable for therapeutic use and its specificity is adequate, so the primary concern is radiation exposure to non-target tissues. Question 23. In the production of radiopharmaceuticals, what is the purpose of using a chelator in radiolabeling? A. It improves the biological activity of the biomolecule. B. It helps bind the radionuclide securely to the biomolecule, preventing dissociation. C. It accelerates the radiolabeling process by increasing reaction speed. D. It reduces the radioactive decay rate of the radionuclide. Answer. Correct answer. B. It helps bind the radionuclide securely to the biomolecule, preventing dissociation. Explanation. Chelators are molecules used to bind a metal or radionuclide to a biomolecule in a stable complex. This binding is crucial to ensure that the radionuclide does not dissociate from the biomolecule during the preparation, transport, or administration of the radiopharmaceutical. Proper chelation maintains both the chemical stability of the compound and its biological function. Question 24. Which of the following radiopharmaceuticals is primarily used in the diagnosis of bone metastases in patients with cancer? A. Technetium-99 meters methylene diphosphonate (MDP). B. Iodine 131 sodium iodide. C. Gallium-68 dotatate. D. Fluorine 18 fluorodeoxyglucoside. Answer. Correct answer A. Technetium-99 meters methylene diphosphonate (MDP). Explanation. Technetium-99 meters MDP is commonly used in bone scintigraphy to detect bone metastases. The compound is preferentially taken up by areas of bone with increased metabolic activity, such as cancerous bone lesions. Iodine 131 is primarily used for thyroid therapy, gallium-68 dotatate is used for neuroendocrine tumors, and fluorine-18 FDG is used for general cancer imaging but is not specifically for bone metastases. Question 25. How does the half-life of a radiopharmaceutical influence its clinical application? A long half-life allows for repeated imaging sessions over a longer period. B. A short half-life is preferred for therapeutic radiopharmaceuticals to reduce patient exposure. C. A long half-life results in higher radiation exposure to surrounding tissues. D. A short half-life is useful for imaging to reduce the radiation dose to the patient while maintaining diagnostic efficacy. Answer. Correct answer. D. A short half-life is useful for imaging to reduce the radiation dose to the patient while maintaining diagnostic efficacy. Explanation. Short half-life radionuclides, such as fluorine-18 used in PET scans, are beneficial in imaging because they decay quickly, thus minimizing the radiation dose to the patient while still providing adequate imaging results. Longer half-life radionuclides are more suitable for therapeutic purposes, where prolonged radiation exposure is necessary for tumor treatment. Question 26. In the context of radiation safety, what is the main reason for restricting access to areas where radiopharmaceuticals are handled? A. To prevent contamination of personnel from unsealed radioactive materials. B. To prevent personnel from ingesting radiopharmaceuticals accidentally. C. To ensure that radiation exposure levels do not exceed recommended safety limits. D. To protect radiopharmaceuticals from environmental degradation. Answer. Correct answer. C. To ensure that radiation exposure levels do not exceed recommended safety limits. Explanation. Limiting access to areas where radiopharmaceuticals are handled is primarily a radiation safety measure to ensure that personnel are not exposed to harmful radiation levels. Access is restricted based on safety protocols to minimize the exposure risk, and all activities in these areas are carefully monitored and controlled. Contamination and ingestion are also concerns, but the main focus is radiation exposure control. Question 27. What is the primary purpose of using fluorodeoxyglucose FDG in positron emission tomography (PET) scans? A. To detect blood flow in tissues. B. To assess brain function and metabolic activity. C. To evaluate liver function and bile production. D. To measure tissue oxygenation levels in tumors. Answer. Correct answer. B. To assess brain function and metabolic activity. Explanation. Fluorodeoxyglucose FDG is a radiolabeled glucose analog used in PET scans to evaluate the metabolic activity of tissues. It is particularly useful in oncology to detect tumors and metastases, as cancer cells often exhibit higher metabolic activity than normal tissues. It is also used in neurology to assess brain function, as brain act requires glucose for energy. Question 20. Which of the following types of radiation is emitted by iodine 131 used in thyroid cancer treatment? A. Alpha radiation. B. Beta radiation. C. Gamma radiation. D. Neutron radiation. Answer. Correct answer. B. Beta radiation. Explanation. Iodine 131 emits both beta and gamma radiation. The beta radiation is primarily responsible for the therapeutic effects, as it delivers ionizing radiation directly to thyroid cancer cells, damaging their DNA and inhibiting tumor growth. The gamma radiation emitted is used for imaging and monitoring the distribution of the radiopharmaceutical within the body. Question 29. What is the role of quality control you see in radiopharmaceutical production? A. To monitor the environmental conditions in which radiopharmaceuticals are prepared. B. To ensure that the radiopharmaceutical meets all required specifications for purity, sterility, and efficacy. C. To track the decay of radionuclides and ensure proper disposal of waste. D. To ensure that radiopharmaceuticals are labeled correctly before administration to patients. Answer. Correct answer. B. To ensure that the radiopharmaceutical meets all required specifications for purity, sterility, and efficacy. Explanation. Quality control is crucial in the production of radiopharmaceuticals to ensure that the final product is safe, effective, and of high quality. QC includes testing for radiochemical purity, sterility, pyrogenicity, and stability to ensure that the radiopharmaceutical meets regulatory standards before it is administered to patients. Question 30. When preparing a radiopharmaceutical for clinical use, which factor is most critical for ensuring that the radiopharmaceutical remains stable during storage? A. The temperature at which the radiopharmaceutical is stored. B. The type of radiation emitted by the radionuclide. C. The packaging material used to contain the radiopharmaceutical. D. The chemical structure of the radiopharmaceutical and its interaction with the radionuclide. Answer. Correct answer A. The temperature at which the radiopharmaceutical is stored. Explanation. The stability of radiopharmaceuticals is highly sensitive to temperature. Proper temperature control during storage is essential to maintain the chemical and radiochemical integrity of the compound. Excessive heat or freezing conditions can degrade the radiopharmaceutical or cause unwanted reactions. Proper packaging and understanding the chemical structure are important, but temperature is the most critical factor for stability.